Okay, in this video, we will cover the palpation of the knee complex. We'll start with the tibial-femoral joint. We'll then move to the patellofemoral joint, and then finally the tibiofibular joint. So starting with the tibial-femoral joint, our first palpation is long axis distraction. Long axis distraction of this joint is done using a leg contact. So I've got her leg between my knees here, and then I am going to contact her distal femur. When I contact her distal femur, I'm going to use an inferior to superior force on the distal femur here, and then I'm going to let my fingers kind of rest in that joint space of the knee complex. So here, and then I'm going to pull against this anchor that I've just established with that contact on the inferior femur. So it looks like this. And you're feeling for that little bit of a distraction. The next palpation is an A to P and P to A. So here, we'll use a web contact on that tibial tuberosity and challenge A to P and P to A. We'll talk about the ligaments that we're impacting here in lab. Next is internal and external rotation of the knee. So with the knee bent, we'll use a contact on the distal tib-fib or down at the foot if your patient is able to tolerate that. I'll palpate over the tibial tuberosity here. Then I'm going to externally rotate. So I am twisting this way. So palpating here an external rotation and then an internal rotation. The last two palps for the tibial-femoral joint are a medial to lateral and lateral to medial. So the way I do this palpation is I will hook my hand underneath, and you guys can see my hand over here. I use that to grab my other hand here and establish a contact on the medial aspect of the knee. I will lock the knee and then just slightly unlock it and challenge medial to lateral. So I'm leaning this way. I'll flip my contact here. Same setup. Lock the knee, unlock the knee, lateral to medial. Next is the patellofemoral joint. So for the patellofemoral joint, we use kind of this contact, and I'm going to plop that right over the top of the patella. So what we'll do with this contact is an S to I and I to S. We'll use our thumbs and move medial to lateral, and our index fingers and pull lateral to medial. So it looks like this. We'll do a S to I, an I to S, a medial to lateral, and then a lateral to medial. The last palpation is a tibiofibular palp. So here we will bend the knee. We're going to establish a contact on that fibular head with our thumb. I'll reinforce it here and I'll press straight back for an A to P. And just like we did in the elbow, we're going to use a little bit of a tissue pull, and I'm going to palpate over the top of that fibula. And I'm going to pull that fibula towards me for P to A, feeling here, but pulling with my left hand here. Last two palps then for the tibiofibular joint are S to I and I to S. Here we can use a bent knee again, palpate over that fibular head, and then when I invert the foot, the entire fibula shifts down. If I evert the foot, the entire fibula should shift up. So if I palpate here, I will invert, that fibula should move down. I will then evert the foot, and that entire fibula should shift up. This was a video of the knee palpation.